Hey, welcome, Doc. Good to see you again.
Welcome all to.
Yeah, welcome to the Red Paw Podcast. Good to see everybody. Today we're talking about something that affects each and every one of us. You might be wondering why I have my cowboy hat on today. Well, today we live in a world where the healthcare industry or wellness has become pretty much the Wild West. Why do we say that? Well, Doc, let's talk a little bit about all the things out there. Yeah,
I go to the convention every year. I get to see what happened in 2010, 2015, 2019, 2020, 2020 after the COVID, and then now. So I keep on top of what's the most important innovations, and why people are using them, and myself what I want to pick and choose to bring into the clinic here.
Yeah, absolutely. And not to say that, there's a lot to choose from, not to say that any of it's bad, but there's just so much to choose from. How do you know what to use? You got obviously here we specialize in red light therapy, which we love. We see great results with. But, you got people talking supplements, cold plunges, saunas, biohacking, functional medicine, fitness influencers, recovery devices. Uh, there's so much to choose from. Where do you start?
Oh,
Where do you start? And so I figured that'd be a good spot for us today. Why do you think everybody's so confused?
well, a lot of it's salesmanship. Okay, they have. Keep in mind, whoever's talking to you, whoever's in front of you, even us today, we have an option that we want to help you with. Okay, and some of them are pretty incredible. There are some pretty incredible devices. They're light, red light, the high intensity electromagnetic therapy today, radio frequency therapies, they're supplements. So if I keep the YouTube ads on and I watch ads, I want to see what people are listening to. And in my own world here at the clinic, helping people, I have to negotiate all those options and testimonials. People, there's just a lot of testimonials, how it helped them. So how do you decide what's the best thing for me at home? What do I take with me on vacation with someone in my family's hurt? How do I help them? And so we're lucky though. Most important thing is some of these innovations have advanced so far beyond. Keep in mind, I've been going to the convention since 2010. Okay, there is an incredible evolution and the value of every therapy we have.
Yeah, so I mean, obviously things have progressed, and that's good for all of us. But I think sometimes we can get into information overload. You got social media experts out there that tend to know it all. You have sponsored content that the moment you open anything up, it's right in front of you because it's been sponsored. Um, as you mentioned earlier, everybody's selling something. Um, so a lot of times you'll see conflicting advice out there because, I hate to say this word, loosely, but agenda,
Yeah,
and
sure.
so, it's like when we have all this in front of us, well, what do we believe? For instance, let's go with eggs. Eggs are bad. Eggs are good. What do you believe?
I've
You know?
watched it. I've watched this story since the 90s. There'll be two every year. Every year, good, bad, good, bad, good, bad. I mean, for decades, I've watched this story. It's a
Here's
classic.
another one. Coffee's unhealthy. Coffee's healthy. What do we believe?
How about wine? How about alcohol? There's another one.
There you go. There you go.
Two drinks a day.
So it's all perspective, I suppose, because I mean, realistically, uh, good benefits and bad benefits according to studies. So I guess you have to judge what's best for your body and test for yourself. But let's
It all comes down to your resources.
100%.
Where you're at, stuff. Okay.
Yeah,
Thank you.
yeah, no, and I think back to resources too. A big thing is trust. Uh, let's talk about that trust for a minute. So, do you trust somebody with 10 certifications and all the credentials out there, or do you trust somebody that has over time proven to be reliable and show results with what they do.
It's there too.
You know,
I've I got stories to tell, which is going to be lengthy. Probably not right now, but I have 12 masters in this, and this, and it's like, and what you're doing doesn't make sense to me. Well, okay. But all studies, a word of advice, back when we used to have phone books, at the beginning of the phone book, it didn't say beware, it said be aware. Okay. Be aware that studies have a goal when they create them, and they can navigate the data to support their opinion. That's called statistics. Very good course in college. Understand how statistics works, and especially in the medical field. And now with AI, it can pick and choose what they think you want to hear. That's AI is an incredible thing, but I believe the single greatest uh, possible side effect of having bad AI is healthcare, because it's going to tell you what you want to hear based on where you're at, based on who's advertising, and it's to me it's the most troubling thing I see with AI. And I love AI. Don't get me wrong. Okay, I love it. I think it's incredible, and but it is now driving the ads we see. So
yeah, yeah, 100%. So you just have to use your best common sense that you have, and look at the things that you deep down can find trustworthy. I myself, I tend to look at people, and when I'm choosing things, I like to look and see more results driven than anything else, because I have had some discussions with some people that have a lot of credentials, but at the end of the day, when I do my own research, what they talked about didn't seem like it was necessarily lined up with the truth. So, like Doc said, a very important thing that he mentioned there is statistics. You can kind of weave them how you want.
mm-hmm.
An opinion is still an opinion at the end of the day, regardless of how many credentials you have. And so, that's why when I'm looking for things out there, I tend to look at results that are coming from what someone does, not what comes out of their mouth and the credentials that are attached, but the results that they see with what they do.
Mm-hmm.
And because one thing that you can't fake is results.
Mm-hmm.
When you see consistent results, that's truth all day long. So that's probably my number one factor when it comes to trust. Let's talk a little bit about red flags, things that might make us a little skeptical when we're trying to decide what to do in any aspect of life or our healthcare and recovery. Um, Miracle claims.
Yeah, the silver bullet. Keep in mind, it's a silver bullet. It's gonna, a lot, especially with a lot of supplements. Oh, this is and we got all these testimonials and all this research. The silver bullet's gonna fit cognitive wellness or make you heal faster. There's some value, and they're not going to talk about what didn't work. You know, they and medically significant results mean 30% of the people got maybe a 30% benefit. So it's not as good as you think. Okay, and that's an important consideration. That just because you saw these testimonials, uh, they're picking and choosing. Uh, the world of medicine or healthcare, and again, red flags. It's different age groups. Kids or youngins up to 31. There's not many red flags except for some serious stuff. 40, the 50s, they're relative red flags. But over 60, some of these red flags are pretty significant. And if you actually look at contraindications for many of these things that we think are awesome, they are telling you maybe you're at risk of complications. One of the reasons I like red light therapy so much and trusted it is because there are relatively few contraindications, relatively few red flags, and all those that exist, we can um, monitor, we can adjust the therapy so that it doesn't become an issue. Okay. And I've seen a couple things over the time that on his personal information that they were pretty bad off, and we just had to take it slow. We had to take it slow at the beginning, but they got the results regardless. But as far as red flags, though, um, your main thing is, what's your state of your health? You know, I mean, if you have extreme fatigue and you got muscle pain in your entire body, you need to pick something that is non-invasive, doesn't have side effects, that creates instantaneous. The minute you put it on it, there's benefit, right? And you can target it to where you want, whether it be whole body or some tightness or trouble points here and there, or just trying to prevent things from getting worse, chronic pain in the knee or the shoulder or the arms or whatever. You want to keep in mind that with red flags, that sometimes we just start slower for a couple weeks and help you get your feet on the ground, get your body recovering. Because keep in mind, what heals your body? Is it the therapy? It's your regeneration. That's what heals your body. It's inside you. When I get this boo-boo on my, I had a senior moment, not that I'm that old, but, and I got a cut, but look, 3 days later, it's totally sutured up, not worried about having a scar, not worried about all that. However, there are people out there that you have to be careful with. Only that's why, again, back to the red light therapy.
Yeah.
It created a foundation for which this healed itself. The body's doing the healing. I just supported it and made sure that it could do its job, which it's doing.
Yeah.
And
The body's an amazing thing when you let it do its own thing, right?
yeah, let it. Hey,
Yeah.
when you get a boo boo, what heals your boo boo? Your body. So.
Yeah, 100%. What about what are your thoughts on fear-based marketing? You think there's a lot of that out there?
Oh, I've been in sales my whole life, and create a need, and the need is fear. Fear of, but some of these things are real. And it's easier to capitalize on that. To sell someone if you. That's why my thing is, what concerns you the most. What where are you at, what concerns you the most, how can we target those things, and here's a timeline of treatment therapies that have proven very successful. It's an investment in your well-being, it's an investment in helping your body heal faster, it's an investment in either preventing it from happening again, or just having this quality of life that it doesn't drag you down because you had something. Injuries, 6 to 12 weeks. If I can make that twice as fast, there's that investment that you're making, it means that you're going to have much less symptoms, much less cost of losing work or sleep or trouble or not being able to take care of things. Not to mention medical costs. How do we keep this cost down with a simple investment up at the beginning? That's why I believe in taking care of your body and respecting it, respecting it's going to heal and do its best, and do your darndest to make sure you don't interfere with that. Yeah, and unfortunately, a lot of medications have side effects, and can actually slow healing, even though they're trying to mainly keep you out of pain. That's a big thing to know. Oh, well, you're in pain. Well, we're going to give you these medications. Well, it's called assumable risk that comes with any medication. Um, it's okay to have these side effects because they're not in pain now. That's the nature of the healthcare industry. Um, but again, there's a lot of advances today that make it that work pretty well. And I just had an experience where I had a minor surgery, and at the end, I said to the doc, I said to the surgeon, excuse me, what can make this heal faster? And his advice was, well, your body's going to heal as fast as it does. He had no solution. Now, he did give me pain medications, which I never took, and they were strong. They were opioids. Never took them. Gave me the antibiotics, which didn't need to take. Okay. But he really did, this healthcare professional, one highly qualified, highly respected. I respected him for doing what he did, but he didn't have something like red light therapy that can help make it heal better, faster, with less, like these, you can imagine, what should I be worried about this becoming a scar? I'm not worried at all, because I realize that I do red light therapy every day, and that it's going to allow my regeneration to happen in a way that is not going to promote scar tissue. Simple, period.
Yeah.
You know, and whether it's the skin or a joint or your spine or you're trying to lose weight, healthy weight, you know, you want these things to get better or improve, meet your goals without some sort of side effects or that's the cool thing about what we do is we can make it simple, and that's why I focus on this. I have other therapies, but I focus on the red light therapy because it's so simple, very few contraindications, all of which we can take care of easily, and we can adjust it to your current health state and your age.
Yeah,
Yeah,
yeah, very, very solid points. Very solid points.
thank you.
It's funny. I was looking at, you get a lot of ads in front of you, as we talked about earlier. And one of the things I saw in front of me not too long ago was doctors don't want you to know this. Should that be a red flag when you hear that in an advertisement or no?
I would say yes. To me, when I see an ad that says doctors don't want you to know this, I immediately. So in red light therapy, I'm a pioneer. Okay, first class 4 bed, my custom chair, at home stuff, and uh, when I see someone else advertising red light therapy and talking about certain things, um, especially what they don't want you to know, um, it's a red flag. Oh, that's what I was going to say. When I was pioneering this red light therapy, the investors said, "What can we patent? What can we make our own so that we have this ability to say, well, doctors don't want you to know we have this very special something or another that is a miracle, the silver bullet."
Right.
And that silver bullet is unique to us. We patent it. We're the only people that have it. We have the proper dosage and combination. Um, and so, as a clinician standpoint, I've been there with investors, and I respect many, many people. But however, it's a classic. It's a classic silver bullet technique of salesmanship, and that's fine. I mean, perhaps it does help. Again, maybe a few people get helped. But the rest of them are just spending money on something that uh, isn't necessarily getting to all the trouble. There's many causes. There's our fitness, our nutrition, our age, or what we're doing as therapies. And so, yeah, that's a red flag.
Yeah.
Can't make that up.
Yeah. Well, like I said, I think it goes back to what we talked about earlier with respects to the trust issue. Try to look local. Try to look at real results that you've actually seen, maybe from a friend or a family member, or that something that can actually be a trusted source, so to speak. And when you see benefits on the regular from a certain source, that's probably pretty trustworthy. Versus falling for something like this fixes everything. Not everything falls into that because everybody's body's different. But real people doing real things, you can't change that. So and that's one of the things I love working here at the clinic with Doc, working with him hand by or side by side rather. I get to see the people that he's helping firsthand, and when you see it firsthand, it changes everything. Because when you see somebody in a situation where they have a problem, and then after weeks or months of utilizing certain methods, red light therapy, whatever it might be, uh, and you see somebody with their problem gone or 80% less than what it was,
In weeks.
it's hard to debate that,
Yeah.
and it really, it's awesome to see firsthand, and it truly helps you keep going because, when you're helping people, that's a pretty good motivating factor. So with respects to the things that I have going on in life, that's I don't know if you call it a 40 thing or whatever, but I think once you get past that age, you stop thinking like a kid, and you just want to do something where you can make a difference in your life before your life's over. And I think,
Well, you got a long way to
well,
go. You
yeah, I'm
got a
just
long way to
saying,
go.
I mean,
Well,
you
yeah.
start thinking differently. You
Yeah.
start thinking, okay, this
Yes.
is the second half of my
Oh,
life. I want to,
I was there. Yeah, I was there.
so it's a privilege working hand in hand with you and getting to see these great results.
And
We,
you never know. And especially today, we're going to live. We're going to be productive. We're going to be independent. We're going to have the ability to enjoy whatever hobbies or travel or food or wine or whatever it is. We have this life extension potential. I'm not talking about living to 200. I'm talking about living to, well into our elder years and being active
Hmm.
and physical and taking and enjoying time with our families and just random however we interact with people. So keep it simple, stay with the basics, um, be aware that there's folks out there selling you silver bullets or extensive long care treatment plans. Uh, that's another one. If you can't get results and see it dramatic, not just significant, but a dramatic difference in that first month, there's um, maybe they're just working for a living and helping some and more than others. But for ourselves, for Nate, for myself, my family, our friends, and those um, especially after 45. That's when you want to not mess around. You can't afford it. You can't, medications and surgeries. You go to a physician, they don't even put their hands on you anymore. They're just like, okay, you got this, here's a symptom, here's a test. Yep, you got it positive. Here's a drug for a while that didn't work. Okay, I'm going to give physical therapy. Okay, well, the physical therapy, well, let's talk to an orthopedic consult for surgery. And then, now you're on that, what we call the slippery slope. Now we can't do this. Now we can't do that. Now we can't do that. Now we have 10 medications or 4 medications or 15 or whatever. So be aware. This is not. This is your chance. This is your one chance. Trust good people.
Yeah,
Oh, yeah.
100%, 100%.
Yeah.
And I think with regards to Red Paw, I think that's one of the big reasons why I created Red Paw. I didn't want to build something just to sell a product. I wanted to build something that people could rely on, something that people could trust.
And you did.
Well,
And you
appreciate you,
did.
appreciate you.
And he did. Okay.
Yeah, and as we continue to help people see more results, put more out there, it's definitely something that brings joy to my heart. Uh, local coach not too long ago had hand surgery, and I was able to put one of my mobile units in his hand,
Mm-hmm.
and he used it in the morning for 10 minutes, in the evening for 10 minutes,
Mm-hmm.
uh, and literally swears by the fact that it helped him get back to even better than he was before. And so, that kind of stuff, you can't buy that. Seeing that firsthand, it's good stuff. Grateful to see, helping people. We had Abby on here not too long ago. I just had a conversation with her. She's a local massage therapist. If you watched our earlier episodes, amazing woman, and she has the same feeling. She just wants to touch it. Like everybody she puts her hands on, she wants to make a difference in their life and truly get to the root of their problem and help them. And it's just awesome seeing her work. And she literally just told me the other day that she's been using the Red Paw unit in every single one of her sessions, and she said it's made she said it like this. She said it's a game changer.
Mm-hmm.
I love hearing that.
Mm-hmm.
Like I said, money can't buy hearing that the people you work with, you're helping them have results. And that's the motivating factor of Red Paw, and what keeps me going is seeing things like that. And I'm just in the beginning stages. There's a lot in the background that's going on right now, building relationships locally with people, where Red Paw is going to do some special stuff, and hopefully we can get the chance to be a part of your life and make a difference in your life, help you feel like you've been recovering. But yeah, just the beginning, but at the end of the day, like I said, it comes from trust. And where Red Paul will build his trust is the testimonials, like I just talked to you about. We're going to continue to throw those out there. We're going to continue to show you that what we deal with isn't just pushing it's changing lives. It's about changing lives. It's about making a difference. And Doc and I both strongly believe in making a difference, and that's why we work so well together. And yeah, we'll just continue to do special things there.
I I consider it an investment. I don't that bed, all this stuff that you see around me. If you come in for a consultation, these aren't something that I was thinking about. Well, oh boy, could I have gotten it less expensive or anything? I was investing in my future. And at 61, having a face wound like this heal so fast in less than 36 hours, totally stitched over and well on its way, no scar tissue. This is the kind of investment that I am thankful I made for almost 16 years now. Okay. Um, this is the future of regenerative physical medicine. Um, and Nate here has worked. He's done a lot of research and a lot of networking to find something that is extremely valuable as an investment in your future for spot treating, tummy time. Oh, you get the flu, put it on your chest. I'm telling you. I mean, I've done it. And you need something you need to be able to give the dose you need. You need it to have the right wavelengths. You need to be able to make sure it can reach the target. You need to make sure you can adjust it, okay? And you want something of quality, okay? Makes it 5 stars. And perhaps that's the trust in you is how come I've been so open to our talks. And there, I'd like to talk more about things, specific cases and things, if I can. But my main thing that I'm going to tell you, you got a car accident, you fall, just a slip and fall, slipped in the tub and you hit your head. You got whiplash. Put that sucker on there. You know what I mean? You don't have to like go crazy, but simple 5 to 10 minutes. You got enough dose, and the way, and you can hit the targets. It's going to make such a difference. So the cost is, what if you don't do it? What if you just go get the muscle relaxer, okay? Or you could just go get some, you know, medications we're pretty blessed. I mean, ibuprofen's pretty cool. I mean, it can take that swelling down in hours. But you don't want to rely on that. You want to
Yeah.
create regeneration,
Your
not
body
just.
working.
So pain relief is called palliative care in medicine. Palliative care, and that's half of what you're going to have is palliative care. And so, uh, invest, invest. Keep it simple. Learn your own needs. Find someone that you can help with, more um, simple things like posture, or nutrition. But
Okay.
anyhow,
Yeah. So
yeah.
basically, all in all, in our conversation today, when evaluating health things that we're dealing with, getting advice on health, rather, maybe there's 5 things we could consider. First,
Okay,
is this person selling fear or hope?
there you go.
Second, do they practice what they preach?
Ah,
Are they open minded?
yes.
Do they acknowledge limitations?
Okay.
And are real people benefiting? There's some simple
Mhm.
5 questions to ask yourself when it comes to getting health advice. If you're being real with those 5 questions, you can come to the conclusion of whether or not you can trust the situation you're in. Because we want you to feel comfortable, regardless of the angle you take for your healthcare. We want you to feel comfortable in the choices you make, knowing that it's going to be the best choice for you. And so, in closing, I know this: the older I get, the less impressed I am with the loudest person in the room. It's not always about that. And then you know, I look at a person like Doc. He doesn't have to be too loud because what he does here in this clinic, it speaks for itself. And so, maybe that's where we want to go with things. Maybe we don't always want to listen to the loudest person in the room. Maybe we want to sit back and look for people that are actually making results. So, yeah.
I just came from a weekend convention in Charlotte. Unbelievable. But the most important thing wasn't the presentation and trying the equipment, okay? It was afterwards, after dinner, just working the room and talking to psychiatrists and dentists and chiropractors and nurse practitioners and doctors, all these different. What did you find? Okay, what did you find? So that I listened to this the hype, but and the science, got to try it myself. But then it was when I started working or having these conversations like we're having. Okay, um, not in a treatment scenario where, well, I'm here, can you fix this kind of thing, but in your own practice, how does it work for you? And that I think that's why, social media and podcasts are so important, because you get to listen to someone share with you the value of this investment, and the mechanism, or the plan, or how to utilize it. So that that's definitely part of my future, is more of this podcast and shooting videos, and we got a list of them. Um, the spot treater that we have here, a couple of ideas, how to, if you have wrist pain, maybe put it here for a couple minutes. We should get into we should talk about a little bit more how to use it, because it
Yeah.
is really a good device.
Yeah,
I
coming up
tell you what,
shortly
yeah.
in one of our episodes, we'll pull out the different kind of red light therapies and show them to you all. Talk about the wavelengths, talk about the different things that make them what they are, and we'll demo right here in front of you what you can see. I think that might be some fun, so we'll do that. But in closing on this one,
Yeah.
maybe the question isn't who should I trust. Maybe it's who's earned my trust over time.
Well, okay. Yeah.
So yeah, Doc and I are here for you. Any
Yes, yeah.
questions, feel free to reach out. But once again, what a great time we've had today. Thank you for joining us, and we'll look forward to seeing you on the next episode of Red Paw.
See you.
Till
As
next
we
time, Doc.
say, ciao. Okay.